Depression is associated with a range of emotional and physical symptoms, including feelings of hopelessness and guilt, loss of appetite, sleep disturbance, and suicidal thoughts. Depression is not an illness that can be seen on the outside. It is an inward illness. People cannot look at someone and see that they may be suffering. Their actions may suggest depression, but it cannot be seen on the outside. Some people hide it very well. According to Leventhal and Antonocci, the most commonly accepted current explanation for depression is the serotonin monoamine neurotransmission theory. According to this theory, depression is due to depletion of serotonin and other neurotransmitters at receptor sites in the brain. Selective serotonin reuptake inhibitors are common medications. They fight depression symptoms by decreasing serotonin blockers in the brain. They're the most commonly prescribed class of antidepressants. The most commonly used are sertraline, also known as Zoloft, fluoxetine, also known as Prozac, citalopram, also known as Celexa, escitalopram, known as Laproxa, paroxetine, known as Paxil, and Pegziva, fluvoxamine, known as Luvox, and trazodone, known as Electra. As with any drug, there are risks and side effects. If one is experiencing side effects that are bothersome and the risk outweigh the benefit, then it is best to speak with a doctor. The doctor can maybe look into changing the dosage or the medication altogether. Some of the side effects of taking the most common used medications are nausea, nervousness, agitation or restlessness, dizziness, reduced sexual desire or difficulty reaching orgasm, or inability to maintain an erection, which is erectile dysfunction, drowsiness, insomnia, weight gain or loss, headache, dry mouth, vomiting, and diarrhea. These side effects may not be the same depending upon the chemical makeup of the drug and the person who are taking them. Most of these side effects go away after the first few weeks of treatment and become less if the medication is taken with food. There are risks associated with taking any drugs. The risks associated with taking the most commonly used class of the aforementioned antidepressants are increased suicidal thoughts, children born with autism, and serious heart and lung difficulties. When taking an antidepressant, it does not mean that the antidepressant will have the same effect on all patients. Some patients have experienced increased suicidal thought. Some feel better after taking the medication. Some people have developed serious heart and lung difficulties, and many women are having children born with autism, and this is being linked to the antidepressants. The benefits of taking the most commonly used drugs for depression are the drugs have a higher percentage rate of managing depression and have less side effects. Symptoms resolve and they get back to their usual state of functioning, and it helps the body reduce cell damage and shrinkage caused by stress hormones. The most commonly used drugs have a higher percentage rate of improving depression. These drugs have fewer side effects and are often the first choice of doctors. If the doctor should have to use a stronger drug, it would be because the drugs didn't improve their patient or the side effects were too much. Medicine is not the only way depression can be treated. It depends on the extent of the depression as to whether or not a person should take medication. If other channels are more feasible and less harmful to the person, then I would suggest not taking medication. The other channels are yoga, prayer, pastoral counseling, meditation, massage therapy, and homeopathic and naturopathic medicines. When examining these issues associated with taking medication to treat depression, there are pros and cons. The pros of the medication are it helps manage depression. Medication allows for one to regain and maintain their dignity, and medication helps a person lead a functional life while living with depression. The cons are without treatment, depression can cause a person to lose jobs, financial stability, and families. The medication can cause risk and other complications, and a person can be suicidal if not commit suicide. Many people suffer with bouts of depression, and most lack an understanding of it. Overall, depression is treatable, and with proper treatment, people can lead functional lives. This disease deserves to be treated with respect because a person can't help they are depressed, but should be assured there is help.